Imagine your family's house is on fire, and the fire department rolls up with cameras, slogans, and a promise that they have concepts of a plan. That is the Republican Party on healthcare in 2025. The emergency is real. The flames are visible. And yet all we keep hearing from GOP leaders is that a serious proposal is always just over the horizon, in the not-too-distant future. For more than a decade, Republicans have built an identity around opposing Obamacare, warning that the Affordable Care Act would destroy choice, bankrupt the country, and ruin American medicine. They voted more than 70 times to repeal or gut the law. They shut down the government over healthcare subsidies. They campaigned on repeal and replace in 2010, 2012, 2016, 2018, 2020, and beyond. And yet, after all that noise, when you strip away the talking points, you are left with something astonishingly simple. There is still no plan. Donald Trump has been promising a beautiful healthcare plan since his first campaign. On debate stages and in interviews, he repeats the same line. He has concepts of a plan, ideas that will be better and cheaper, and we'll hear about them soon. Mike Johnson, as Speaker of the House, confidently claimed Republicans had proposals ready immediately if the government reopened. But when the cameras come back weeks later and reporters ask the most basic question, where's the plan? The answer dissolves into vague assurances and blame shifting. Concepts, options, ideas, never a bill. This isn't just a messaging failure. It is a structural failure. Republicans have had control of the White House, the Senate, and the House at the same time. They had the votes and the power to put their vision of healthcare into law. The closest they came was in 2017, when John McCain walked onto the Senate floor and gave his famous thumbs down that killed the GOP repeal effort. That moment didn't just sink a bill. It exposed a deeper truth. There was no coherent replacement behind the slogan. The irony today is almost painful. Trump rails that Obamacare sucks and insists the system is broken. Yet one of the central ideas being floated around his circle is to extend the very same Affordable Care Act subsidies that Republicans shut down the government to stop. The Working Families Tax Credits, the enhanced ACA subsidies. These are exactly the tools that put money in people's hands so they can buy insurance on the exchanges. In other words, subsidies. The same mechanism the GOP attacked as socialism is now being quietly repackaged as putting money in the hands of the people. If this sounds less like a revolution and more like a rebranding exercise, that's because it is. Obamacare is one of the most popular federal programs created in decades, ranked alongside Social Security and Medicare in terms of public acceptance. Americans do not want to go back to the days of being denied coverage for pre-existing conditions or being one illness away from bankruptcy. Republicans learned that the hard way. They could not overturn the law because voters wouldn't let them. So today, instead of repeal and replace, the reality is resent and rename. Meanwhile, the consequences of this leadership vacuum are concrete and brutal. Healthcare premiums are rising again. When subsidies lapse, working and middle-class families are the ones squeezed. Some will drop coverage entirely because they can't afford the monthly bill. That means more people delaying care, more patients showing up in emergency rooms with advanced illness, more hospitals strained by uncompensated treatment, especially in rural and low-income areas where closures are already a crisis. And it is not just about insurance. While think tanks like the Heritage Foundation draft blueprints for Project 2025 to reshape government, roll back regulations, and wage cultural battles, they have remarkably little to say about building a sustainable, equitable healthcare system. There is a detailed plan to restructure the administrative state, but not a credible plan to keep cancer patients insured or hospitals solvent. The message is clear. Power comes first, healthcare later, if ever. Even some Republicans admit this, at least when the cameras feel less threatening. They talk about lots of bills and lots of ideas, but concede there is no consensus, no unified proposal, no single framework that the party can rally behind. That is not just a policy gap, it is a moral one. In the richest country on earth, where medical bankruptcy remains a uniquely American shame, the party that claims to stand for responsibility and efficiency cannot agree on how to prevent families from being ruined by illness. Democrats, for all their internal debates, public option versus Medicare for all, Incremental reform versus structural change. At least put actual plans on the table. The Affordable Care Act, with all its imperfections, is a real system with real benefits that can be measured, improved, criticized, and defended. You can't say the same about a concept of a plan. You can't take your concept to a pediatrician, a cardiologist, or an oncologist when you lose your job or your premiums double. In the end, the healthcare fight is not an abstract ideological chess game. It is about whether a parent can afford to take a sick child to the doctor, whether a worker with a chronic illness can keep their medication, whether a family can survive a diagnosis without losing their home. On those questions, the Republican Party has offered outrage, slogans, shutdowns, and endless promises of a plan that never arrives. So here is the uncomfortable question the GOP has not answered after 15 years of anti-Obamacare politics. If Republicans truly believed they had a better way to protect Americans' health and lower costs, wouldn't we have seen it by now? And if we haven't, is it because they can't build a plan or because they just don't care enough to try?